sure if you should see a chiropractor or a physical therapist for your problem, which one is better? You're probably thinking that since I'm a chiropractor, I'm going to give you a biased opinion. However, I'm definitely qualified to give you the honest truth. I worked in a multidisciplinary practice for 2 years following graduation, where I worked alongside physiatrists and physical therapists. So I'm going to give you the differences, and then you can make your own informed decision when it comes to your healthcare, because everybody is different. So what might work for one person might not work for the other. First, what do we have in common? We do have a lot of similarities despite the perceived conflicts. Both of us mainly deal with musculoskeletal issues. We are non-invasive. We do not use drugs or surgery. We both have the same treatment goals. So reducing pain, reducing inflammation, spasms, improving joint function, improving range of motion, functional ADLs, which is your ability to be able to do regular movements such as bending, sitting. We both do some form of manual therapy. So other than adjustments, I also do joint mobilization. I do stretching. I do soft tissue work. I have a physiotherapy license as well. So even though my office, I mainly stick with laser and stim, I do have the ability to use passive modalities. So obviously the main difference between chiropractic and physical therapy is chiropractors are trained to do manipulation. So we do that chiropractic adjustment. And as I said in a previous video, in my particular office, I do give exercises to my patients. You might not get that with every single chiro. And even though I have the training and the ability, I'm going to be honest to say that rehabilitation is simply not my specialty. I do not have the equipment for patients to do it right here in the office, and I do find that it's pretty lengthy to explain an entire rehab program when a lot of patients are simply not compliant. They do not do it at home. So this is where I feel that physical therapists do a lot better job as far as the rehab exercise portion, especially when it comes to an extremity injury such as like a knee or a shoulder. Another main difference is that chiropractors have a portal of entry status, which means that you do not need a referral to come and see us. If you are going to go see a physical therapist, you do need to go to another doctor to get a referral. You also cannot get x-rays directly from a physical therapist. So when you come into my office, if you're not really sure where to go, you can start with me. If I need to refer you to another doctor, I can send you for x-rays and MRIs. So this is certainly a better option for you if you are in acute pain, like you just injured yourself and you want to get some relief right away. Most patients who visit me on the first time, they feel a little bit of improvement, if not more. Physical therapy is going to tend to be a lot more gradual. Lastly, I just want to add that it doesn't also have to be one or the other. It can always be both, and that's a great combination.